Yeah, technology challenges.
Okay, I think we are live now. So hello everyone. Thank you so much for joining Voice of Healthcare broadcast. Today the session is Futuristic Friday, and I'm your host Koustuv Chatterjee, principal with Sullivan's Global Healthcare Practice. And today I'm with Dr. Sunita Maheshwari. Dr. Sunita, thank you so much for your time today. It's a pleasure to host you. And before we proceed with our discussion, it's only fair for me to introduce you properly. So, everyone, I think most of you are already aware of Dr. Sunita Maheshwari. She is a leading pediatric cardiologist, a chief dreamer of teleradiology and RxDx clinics. We'll get into what that means shortly. And then obviously she's also a board member of GSK, a global pharmaceutical company. She has been trained in Yale University, US, and she has been voted as one of the most powerful entrepreneur and inspiring philanthropist in India. So it's a pleasure again to have you, Dr. Sunita, and we will have a very open and free-flowing, candid conversation around the future of healthcare, where the industry is heading towards, what it really needs to basically have that complete digital transformation of Indian healthcare scene. So, with that being said, as I clearly suggested earlier, trying to understand from your standpoint of view, what does a chief dreamer do?
Actually, it's a misnomer. There really should not be a hierarchy in dreaming, I think.
Yeah,
So
yeah,
I want to, if I had to change my thing, I would change it to dreamer. But, in India, we love chief. So, either chief executive or chief
yeah,
marketing or chief something. So I
yeah,
picked chief dreamer because I think for me as a doctor,
yeah,
being able to dream of different solutions is what
yeah,
I've been good at. I
sure,
worked in a super specialty hospital and
yeah,
then was thinking about primary care solutions.
yeah,
I kind of dreamt really of telemedicine became 10 years before it became legal in India.
correct,
When COVID hit, I was constantly, I would get up in the middle of the night with, oh my God, we have to be ready for home healthcare. We've got to
correct,
do this. So constantly, almost wake up with ideas for how things can be done better. So that's why I'm
hmm,
dreamer, but I've changed my title a little. It's chief dreamer and loop closer, because I also realize that unless you can push through the idea, you can
yeah,
dream, but then
yeah,
you kind of need to also push that idea through, close that loop 100%. So
yeah,
yes,
yeah.
that's me.
No, that's fascinating to know. And I was actually going through your profile and the journey you had in the Indian healthcare sector. But even prior to the Indian healthcare sector, you were in US. You started off with a very successful venture called Teleradiology Solution, which you started in early 2000. Now it has presence across, I think, 25 countries, if I'm not wrong.
Yes.
At least you
Yeah.
have your solutions being present in those countries. So now, tell us about the journey you had in India in particular, because I'm really looking forward to understand the maturity level of teleradiology solutions from Indian healthcare context. What are the challenges you faced initially before you had set up your office in Bangalore and you started operating from South India? And then what are the key advantages also you had as an early mover venture in India with the teleradiology solution?
Yeah, sure. I mean, I think teleradiology is basically the transmission of data, of images, CT
Yeah,
scans, X-rays, MRIs, ultrasounds, from one
yeah,
place to another place. And
yeah,
when we moved back, my husband and I both trained
yeah,
at Yale University in New Haven.
yeah,
And when we
yeah.
moved back to India, interestingly, he couldn't get a job here. So that's how we actually first started by he was reporting for Yale University from here. So doing the same job. I mean, today in the pandemic, everyone's working from home, right? But I think 20 years ago, that concept that you can sit in Bangalore and work for, the United States of America, it was unheard of. So that was essentially teleradiology. And initially, we had a lot of challenges because bandwidth wasn't good in India. It wasn't accepted in the US.
Yeah.
that you would cover something so high end. It was very high end work coming out of India. But I
Yeah.
think once you get over those were a lot of advantages. For instance, the US night time is India daytime. So
Right.
if you use a night shift, you're covering the night shift in the US, it's so much easier doing it when your doctor is awake in India. And
Yeah.
so I
Yeah.
think that concept first was the global, back and forth. But
Yeah.
then that idea of if you have a highly trained doctor in one place, taking his
Mhm.
expertise to places that don't have a good diagnosis. Because
Yep.
fundamentally in medicine, if you can't make a good diagnosis, you can't even get to, okay, what's the treatment? What should I do surgery? Should I not do it? What medicine should I give? Before the first step of a good medical plan is to have a good diagnosis. And in a lot of places in India, you don't have that because there are only 10,000 radiologists, right? And there are 1.3 billion patients across the country. And that's where something like a teleradiology comes in, where you basically can have a doctor sitting in Hyderabad, Mumbai, Calcutta, wherever he wants to be, and then using, if he has good bandwidth and a good reading station, can provide reports and diagnoses to hospitals anywhere. So I think we have seen in India a in the last 5 7 years quite a lot of people doing tele, wanting to move to tele, and post COVID even more so, because radiologists couldn't go to the hospital, or they didn't have to go if they could report from home. And I think the governments in the last few years in India have really understood the benefit of teleradiology, because you can take that expertise out there. So, for instance, we help set up teleradiology for the state of Tripura, and all the PHCs and CHCs wherever there's an X-ray machine. So the advantage of tele would be that governments or hospitals or diagnostic centers, whoever, can invest and set up the hard stuff, the scanners, and then the actual day to day reporting can be sent to wherever the doctor is. So there's also, I would say, apart from the convenience of day night or the convenience of getting out to remote areas which don't have a radiologist, the other convenience is one of kind of economy of scale and efficiency. Because if you have, let's say, in a hospital at a night, or you have 10 scans, for that, you have one doctor sitting up the whole night reporting those scans. Instead, if you had one doctor reporting for 5 hospitals, right? So he gets enough work to do he can report 40 or 50 hospitals, 40 or 50 scans. So you've got that one doc who's able to cover multiple centers, and that is what teleradiology enables. So it's a great solution for the hospital or diagnostic center. Now, and then it's a very good solution for the radiologist as well, because his time is well utilized. So he's not, he can really be very efficient. And especially when you have a shortage, our country has a huge shortage of qualified manpower.
Yep.
So
Yep.
when you especially have a shortage,
Yep.
using the existing manpower, your trained manpower
Right.
well, makes
Yep.
a huge difference.
Correct.
Yeah.
Yeah. So now I also wanted to kind of ask you about the role of AI in radiology. We have done a lot of research in this field over the last few years on behalf of Frost and Sullivan. We have a dedicated team that tracks the role of artificial intelligence technologies on radiology. And we know for sure that in US, in particular, EMR companies are actively leveraging AI solutions to also enable physicians to kind of optimize the performance of traditional radiology systems. But when it comes to the role of AI in the Indian radiology market, what were the challenges that you faced initially, and what's your vision really for future after COVID-19? Do you think that AI will have a mainstream application in the Indian teleradiology market in future?
So I think, in all of healthcare, if you look at, all the fields of healthcare, where obvious artificial intelligence can make an immediate impact and can easily be utilized, is really in radiology, because radiology is very data driven. You're getting large sets of images. And so if you have algorithms that can auto detect stuff for you, type up a report while you're even reviewing it, measure lesions. You can actually make everything that much more efficient. So, as I said earlier, the benefit of teleradiology has been it's helped where you have a shortage, because there is a huge Indian shortage of radiologists. Now, AI, so the work that's being done right now. So, for instance, I'll give you some examples. There are a lot of companies around the world that are working on algorithms that will, for instance, auto detect breast cancer, auto detect a fracture, auto detect a pneumonia. So if there's an X-ray, it will tell you there's a pneumonia. If there's an X-ray, it will tell you there's tuberculosis. So for instance, we did a validation study for the Gates Foundation, looking at all the AIs that are out there to auto detect tuberculosis, because that's a huge public health initiative. If you can, you can do all these X-rays, but then if you don't have radiologists, it's a problem. But if you've got that algorithm that's going to tell you, hey, there's TB, there's no TB, there is TB, get them on treatment, it can really, really be a game changer. We at our own company, we've developed an algorithm for brain bleeds. So in patients with stroke, within a minute, if it goes green, that means, all good, go ahead, there's no stroke. If it's red, that means, okay, this patient, the radiologist needs to get on it. Now, you do obviously today, even if you have AI integrated in your workflow, you still need the radiologist to look at it, validate it, type out, send out the report. But what the AI does is it kind of is like a triage. It will put it at the top. So if it's a stroke case, it's going to say plop, 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 so the radiologist gets to it. It takes 1 minute to look and see if there's stroke or no stroke. So it can really, one, make the radiologist more faster, much more faster, more efficient, and also more accurate. The estimates are that there are 20 million radiology reports globally every year that have errors. So you know how patients go with their reports, they don't trust, right? So I think what AI will do is will increase accuracy as well. So not that it's going to get rid of radiologists, but it's going to make them faster. It's going to make them more accurate. It's going to make them less likely to miss. I think what's happening today, unfortunately, is that there's so many algorithms and they are on different platforms. So for a doctor, it's like the app. You ask people that, okay, everyone's sick, how many apps will they download on their phone, right? So if you ask a doctor, ki, acha, for brain bleed, you download this algorithm. For breast cancer, you download that algorithm. For an X-ray chest, you download this algorithm from this company. It's, the utilization becomes an issue. So as this thing evolves, if we have a platform across which, everybody puts in their algorithm. So for a doctor, it is just one workflow. He's not going from, this software to that software. It's one consolidated software for him. He clicks, he's got that algorithm for the brain bleed. He clicks, he's got that algorithm for tuberculosis. Then it becomes easy for the doctor to use. We haven't yet reached that. Every company will try to sell a doctor that two algorithms that they have developed. But I think in the next, and it's Futuristic Friday, and where are we going to be? Certainly, I think these algorithms are going to become, see, they're all now at around 92% accuracy. When they become at 100% accuracy, and when they can be easily kind of integrated with radiology reporting platforms, and they can be at a price point that doesn't pinch, because obviously, like for instance, an X-ray, if you charge a patient, 70 rupees for an X-ray, then you have your cost of your wrist packs of 10 rupees. Then you have your radiologist cost. Then the diagnostic center needs some, money to be made. So how much can they pay for an AI algorithm, right? 10 rupees. So when you get to a point where the algorithms can be at low cost and onto platforms that people are using for reporting, then you're talking mass utilization. So right now it's still in, testing data sets, putting it up in 5-7 hospitals, trying to get more data, trying to see how well it works, trying to make that algorithm much more efficient. But I think that the space is moving very fast. I think to some extent COVID has helped. It's also been a distraction, because I think during COVID times, everyone's been trying to get an algorithm for COVID detection on X-ray or CT. So, a lot of the focus has been there because obviously you want to get that algorithm out to help as many patients. But certainly, in the next, if you look at a horizon of the next 3, 5 years, the algorithms will be mature, the platforms will be mature, the models will be mature, and therefore the utilization will also really, bump it.
Yeah, so I've done a lot of research in this field as well, and one of the concerns physicians shared with us is the fact that whether the AI algorithm that Indian teleradiology companies are building is relevant for their business or not. And some of the data scientists are trained with algorithms that learn from a patient population and the data sets from Western markets, right? So it's not necessary that we have proper representation of Indian patients, data sets that
Yeah.
really support AI-enabled clinical interpretation of advanced radiology images. So speaking about that particular bottleneck, do you think in future there would be a need to create more ethical, more personalized, more regional AI algorithms that we need to build here for our own patient population?
I think for sure. I think, India has enough. We have the data, we have the doctors, we've got the scientists, we've got the engineers. I mean, God, look at the number of computer scientists we produce, right? So I think we certainly, and I think, a lot of the investment has gone into Israeli companies and American companies. But I think it's high time, we put our money where our mouth is, invested in our own Indian entities. And you don't need, I truly, if you get me into the whole concept of funding in healthcare, I truly believe it shouldn't be too much, because the minute it's too much funding, it changes. You have to come out and you have to earn a lot of money on that, and the whole game changes. But enough funding to help engineers and doctors, data scientists work together, produce indigenous homegrown algorithms for homegrown problems. I mean, in India, you're going to want algorithms for tuberculosis detection. That's really important. You're going to want algorithms that can, pick up stroke very fast and get them to the hospital. So you're not going to look into very complex, interstitial lung disease and stuff for an algorithm right now. Because the use case, we first need to look at our common lesions. Like if you took a chest X-ray, do you have 20 algorithms that can tell you everything that's on it? So I think simple stuff which can be used, which can then be deployed in cities that don't have radiologists, and then if it gives an alert, okay, it's positive for this, you get a set, you have a built-in second opinion that a human can look at it. So I think certainly, I think from India we should do it. I mean, I think there's no reason why we can't be building algorithms. And I will tell you, like our algorithm, we built out very low budget, we're just passionate young engineers. You have the data sets, you've got the engineers, you need someone who understands it to guide them. And they're not that difficult to build out good algorithms today. The challenge is to get it to like a 99% and to get everyone to use it. I think, to change user behavior, doctor behavior, that's going to be a larger challenge and a price point that makes it, affordable for everybody.
Yeah. So apart from price points and funding in this sort of progressive technologies, do you think from policy standpoint, a regulatory outlook that clearly lays out the importance of such a solution in the Indian healthcare context is required in future? And there should be a clear framework in place supported by government of India that, okay, this is the current state of the radiology market in India, and we need intervention from progressive solutions that are obviously driven by capabilities such as AI, but then we also need to focus on how to make it more effective, personalized, and Indian, so to speak. So do you think from regulatory standpoint, policy intervention is also equally important?
Unlike clinical trials, the radiology data sets they don't harm anyone if you look at the data sets,
Yeah.
So the privacy issues are not as big as long as you encrypt the data. So
Yeah.
I think I don't believe, we need to necessarily look at government for everything. And I think over-regulating this is also not a great idea. I think where government could help is if it gave this kind of mandate that we're going to use made in India algorithms, and I've seen the government actually do it. I mean, We, for instance, our group has been working with IGIB during this COVID time, looking at all the algorithms that are out there for COVID detection. And this was IGIB is a government body, so I think the government is saying, you know what, if there are interesting solutions out there, we want to know about them. And we want to see how we can deploy it and use it. So I think as long as government allows kind of doesn't stifle creativity and innovation,
Yeah. Yeah.
people will figure out how to kind of work in this space and get things out there. It would certainly help if you had a government that says, hey, we would, because the government is the one who can deploy at scale,
Yeah.
who could
Correct.
really who could really take a TB algorithm and deploy it across all the community health centers in the country. It could be game changing. So government I would say, as maybe a grandfather, a fatherly figure saying, make in India. I think
Yeah.
that's definitely a push right now. So continuing that policy of, why don't you get it out there? Don't spend too much money, but give
Yeah.
us good algorithms, and
Correct.
let's make for India and from
Yeah.
India for the world as well. I think that would
Sure.
be a great strategy going forward.
Okay. Sounds great. And looking forward to such innovation and intervention from regulatory bodies as well. So now, moving our discussion towards another topic, which is the new theme in the digital health sector globally. We call it telehealth. Some call it tele everything in healthcare. So everything is done through telemetrics and telehealth enabled solutions, right? From tele ICU to teleradiology to tele primary care, everything is done through telehealth related solutions. Um, COVID 19 has also thrown a big question to all of us whether telehealth is the future of healthcare. Whether 70 to 90% of all patients that still rely on brick and mortar physician offices will completely transition to a virtual care platform, and they will moving forward only leverage telehealth solutions to get consultation done from their providers, or there should be a hybrid model where the brick and mortar model will exist and will not lose its relevance in years to come, but then increasingly will see a shift of a majority of patients moving towards telehealth, or maybe using both the capabilities in tandem. So what has been your experience? You run RxDx clinics in Bangalore. You have completely transformed how historically healthcare was delivered at a primary healthcare setting. So, what has been your challenges during COVID-19 when patients couldn't come to your clinic, and what you learned from it, and do you think that there is any space for hybrid model in future?
No, I think it's an interesting question because, obviously, in March 23rd, Red Letter Day in telemedicine in India, because the Ministry of Health, legalized telemedicine. And I think one of the bottlenecks for telemedicine in India was the fact that the laws were so unclear. The Telemedicine Society, of which I'm a member, had been working and had actually given very clear guidelines on what could be the legal aspects of telemedicine, but it took the COVID pandemic for the government to legalize it. And I think that really, in a sense, has opened up the gateway to telehealth. Now, having said that, of course, because of the pandemic and people's hesitation to come to hospitals and clinics, and the fact that the government legalized it, everyone was immediately looking for a tele solution. Like, how can I reach out to my doctor on tele? And the number of telemedicine companies, overnight, Zoom went to the roof, and the number of consultations also went up some staggering 500 times compared to pre-COVID. And certainly, I think telehealth and telemedicine is here to stay, because once people have tasted it, it's like the Swiggy apps and the, all of that. Once you've experienced it and you're like, hey, I can talk to my doctor and get a pretty good consultation and an opinion, then why do I need to go sit in a hospital and a clinic and wait for my doctor? So for us, it was interesting because, especially for me, I'm a super specialist. I'm a pediatric cardiologist. But having trained in the US at Yale and coming back to India, I practiced for 10 years as full-time pediatric cardiology. And I realized that there was this need actually for primary care clinics where you don't come to a super specialist for everything. So, for instance, if a child not gaining weight. They come to the cardiologist to rule out the heart. Whereas you should have a good physician who tells you first, maybe it's just worms, right? I mean, but primary care in our country has been traditionally undervalued, unfortunately. So that's why I built up RxDx Health, which is a chain of primary care clinics. Now, obviously, when the pandemic hit, like in April, we had almost zero footfalls, zero. I mean, nobody was coming to the clinic. And then people were staying home, so they weren't breaking bones and falling down. And then people were staying home, so they weren't, getting respiratory infections. So maybe they didn't even need to come to a clinic, but there was also a lot of fear. On the other hand, our teleconsultations went up 10 times. Earlier we were doing like one or two a day, then we went up to 100 a day, 150 a day. So the patients were reaching out by tele. Our home care went up dramatically. I think our home care went up 50 times. People wanting pharmacy drop-offs at home, and then we started COVID care at home. So we morphed overnight into a tele company, into a home care, because that's what patients needed. Now, as the pandemic has kind of, we're over a little bit of the fear, people have started moving around in India. What I'm beginning to see is they're coming back to the clinic. And now, volume, the telemedicine numbers have sort of plateaued. It's not like it's going 150, 300, 400, 500. It's plateaued at where it is. And the patients coming back to the clinic has started increasing month on month. I mean, this month, October, we were back to almost pre-COVID levels. Now, why is that? Why are patients coming back to a clinic? Why are they going back? Because at the end of the day, there are some things you will need to go to a brick and mortar for. For instance, you want your health check and you have to get on a treadmill. You have to come to a clinic. You are going out and you get a wheezing attack, you need nebulizer, you have to go to a clinic. You've got a skin lesion, you've been showing your doctor like this, it's not getting better, you want to go show it to him. You feel palpitations, you want your doctor to listen, to your chest and lungs and so on. So I think there is a need, obviously, for patients to go to a clinic, but there's some things certainly you don't have to go to a clinic. I mean, you're feeling depressed, go online. You kind of have a runny nose and you want like something for your virus. First step can be online. If you don't get better, actually go see. So I think you want a nutrition consult, you don't need to come in. You can come in for your body composition. So I think the world is going to be digital. A mix of physical spaces where you come in for some stuff, and definitely tele where you do other stuff. So parting words on that, because I see it's 6:30, is we've done like a bubble health check. So basically, the day before, we will send someone to your house to pick up your blood and check your vitals, that kind of stuff. Next morning, you come in before 9 a.m., before the clinic gets busy. If you have to get your echo done, your x-ray done, your treadmill, whatever diagnostics you do it, you go back home. You're done in half an hour. Then all these reports are put together and you see your doctor via telemedicine. So it's a very mixed model, as you can see, of leveraging, minimizing the time in the physical, and maximizing your efficiency. So using the home and using the clinic and using technology to interface both.
Sure. We have a few more minutes left, and you mentioned telehealth is here to stay, and that's very encouraging for my clients that I'm serving in the telehealth side. However, in the digital health market overall, one challenge has always been there. The investment has come. Some of the digital health companies are most well funded across the globe. They are valued at multi-billion dollars. But when it comes to generating real revenue, they often struggled. It's a highly B2B market. Digital health companies are actively evaluating options to reach out to consumers directly and sell their solutions directly to them so that they can then showcase evidence of meaningful revenue generation for a sustainable period of time. So you talked about telehealth being a relevant option in future. Brick and mortar will also be there. But for general primary healthcare consultation, do you think there is any scope for medical devices to come in between, where consumers can use those medical devices to capture vitals and then send those information on real time to their providers. And then providers through a telehealth platform can view those vitals and then recommend appropriate interventions, prescription drugs, etc. Do you think that from India, I know that it's happening already in US, but in India, do you think in future there would be any scope for such a capability?
I think for sure. I think the healthcare IoT devices and so on. I mean, already people have gotten used to their phones, their Apple watches, which are measuring their steps, and now you've got the watches that can also look at your heart rate. So I think certainly there's that. Now if you're going to bombard a doctor with too much information, it depends on how much time the doctor wants to give looking at all that information. So, for instance, you've got now ECG monitoring where the
Yes,
alerts can go to the doc. I was getting so many
yes.
alerts, I had to fix the alerts off and say, so I think a little bit is going to be the practical part of, how many patients can a doc monitor with lots of information coming to them, and are they going to monitor it 24 by 7? But I think certainly a model wherein some of that information goes to the doc
Yeah,
is very useful. And I certainly use it as a cardiologist, telling them, okay, if you've got a fast heart rate, let me send me the strip at that point, so on and so forth. I think to your first point about investment, I know the PE guys don't like me and all, but I keep saying don't put too much money into healthcare. Not 100 million, 150 million, because then the whole focus becomes customer acquisition. How are you going to bombard with marketing? I
yeah,
think healthcare, if you have a good product and you have good doctors and you do good delivery, you don't have to spend a lot on marketing and trying to corner market share. Because you just have to collaborate with each other, and a lot can be done without huge amounts of money.
yeah.
You need a lot of money, yes, if you're doing cutting edge research and all of that. But a lot of the marketing goes, a lot of money goes into large marketing spends.
Yeah, yeah,
And so healthcare, I think, the good old fashioned, I'm a little old fashioned, but good docs, good delivery,
yeah.
doing it the right way. You have to be patient. It's not one of those you pump a lot of money, especially in India. The more you pump in, it doesn't mean the more you're going to get. You have to be patient and build up a good customer, patient base, good doctors, that trust, that whole, ecosystem.
Thank you, Dr. Sunita, for your time today. This has been truly a masterclass of business, entrepreneurship, and the future of healthcare. We have learned a lot from all of you, and thank you so much. Obviously, I look forward to stay connected with you even after this. Continue to learn from you as you, expand your business in India and roll out new solutions that are obviously progressive and AI enabled in the future. So, with that being said, I would like to conclude the session for today. And thank you again, everyone, for your time today. Thank you.
Thank you.